This is Alternative Political Analysis, and this video will be on Trump's healthcare plan and options. And in his State of the Union address, he said he would cover pre existing conditions. That's a positive. He said he would provide tax credits for working class patients. I'm skeptical if he will be successful or if it will work or if he is genuine and sincere. He said he would create health bank accounts. That's a bad idea. It won't work for working class patients, and that will come back to bite him in the backside in 2020. He said he would expand Medicaid block grants to states, and that's a positive, but I am skeptical if he is sincere, whether he will be successful, and if it will work. Also, I'm skeptical of how much cuts and savings would be need to be made in other domestic government agencies. He said that he will make it possible for patients to buy across state lines, and the question I want to ask is how will he make insurance companies pass on tax savings to patients? He said he would lower the price of drugs, and that would mean breaking big pharmaceuticals' stronghold on medication market. He said he would lower healthcare costs for patients and lower operating costs for doctors. He said he would ensure patient choice in health plans and doctors, and this is similar to Obama's promise of if you like your plan, you can keep it, and if you like your doctor, you can keep it. Will he be able to deliver? I'm still skeptical at this point. And in my opinion, he ought to reconsider his position on health in the year 2000 and 2001, which was single payer healthcare. And if you have been following events on Twitter, even a prominent figure on the far right, Richard Spencer, advocated single payer and thus dealing with American healthcare problems, and libertarians and anarchist capitalists derided him as a socialist for daring to suggest that America should provide health care and medical care to its citizens. And Trump should at least offer the public option, which is basically government health insurance. And Trump will probably mandate coverage of pre-existing conditions with a bill being made into a legislative statute through Congress. He will remove state lines, that is clear. And he will pass budgets with healthcare tax credits, in my opinion. And I think he will try to introduce healthcare bank accounts. I don't think he will be successful, and I sincerely hope he is not successful, because I honestly don't believe this will help working class Americans get health coverage. He will try to pass statutes on drug prices, as Bernie Sanders tried to, and the Democratic right wing killed it, and they were wrong to do so. That means Donald Trump, Bernie Sanders, Ted Cruz, and John McCain all agreed on an issue that would have helped the American people, but so-and-sos like Cory Booker and Kirsten Gillibrand thought that Americans didn't need affordable medication. Trump will try to legislate competition in relation to the insurance market. How he will do this, or whether or not it will be successful, is not clear yet. And he may try to mandate that insurers pass on tax savings and lower premiums. This may temporarily assist working class Americans with health coverage, but it is not a long term solution, nor should it be viewed as such. And I would recommend that viewers check out the Alternative Political Analysis YouTube channel, Facebook page, and blog for more interesting posts and videos on this subject.